Everything comes from ASA's determination to increase laser therapy's applicative possibilities through prestigious scientific cooperation and from dialogue with our partners, research institutes, doctors, physiotherapists and ASA customers. Objective: to treat the deepest-seated pathologies in total safety. The result of LN research and technology combined with ASA commitment, the systematic use of scientific analysis and experimentation, together with constant and cooperative contact with the official research world, allows us to offer totally innovative equipment and therapeutic techniques. We not only acknowledge and often anticipate laser therapy progress, but also share many of our customers' goals, bringing them to fruition. Innovation, therefore, becomes available. The vertical energy of the HILT impulse is a pulsing power emission with particular characteristics that allow it to act deeply, with very high energy doses exalting the positive effects used in achieving the therapy's objective. Liquid reabsorption, return to physiological balance and stimulation of tissue metabolism are accelerated considerably. As a whole, the therapy is faster and more effective, an advantage for both your patients and your work. HILT therapy can be applied in the treatment of every pathology that, due to its deep-seated anatomical location, has to be reached with an energy dose sufficient to trigger an intense biostimulatory effect. Thanks to its deep-acting biostimulatory efficacy within the ambit of regenerative therapy, HILT allows the successful treatment of osteoarthritis, as it does with other degenerative chondropathies caused by metabolic imbalance or traumatic events. Overloading, trauma and subacromial conflict can result in inflammation of the rotary cap, one of the shoulder's most common pathologies, and frequently causes humeral scapular periarthritis. The HILT impulse, through the muscular bundles on which it exerts a powerful relaxing effect, stimulates local circulation, encouraging the tissue's metabolic rebalancing before reaching the cuff and exerting a powerful anti-inflammatory action upon the tendons, resulting in rapid pain relief and the restoration of functionality. Epicondylitis is an inflammation of the wrist and hand extensor muscles and tendons at the level of their proximal insertion into the lateral epicondyle. It is caused by a single trauma, or more frequently by a series of overload microtraumas, causing microacceleration of tendon tissue. The HILT impulse reaches the tendon and adjacent areas, quickly reduces inflammation and pain, stimulates the process of microlesion repair and activates lymphatic drainage, allowing the absorption of the swelling and leading the patient towards rapid functional recovery. Carpal tunnel syndrome is caused by inflammation due to overload of the tendon sheaths that cross the carpal tunnel. Their inspissation compresses the median nerve, causing anything from a slight tingling sensation up to a persistent pain that greatly reduces movement. The HILT impulse reaches the carpal tunnel under the transverse ligament, improves local circulation, thus enabling the restoration of the tendon's metabolic balance, reduces the inflammation and therefore the pressure on the nerve, and induces a rapid improvement in the symptomatology. A herniated disc is a frequent cause of backache. The disc between the vertebrae leaves its seat, compressing and inflaming the adjacent spinal roots with the consequent sensation of extensive pain. The HILT impulse crosses the muscular bundles covering the disc, exerting a powerful relaxing effect and reaching the heart of the nervous inflammation, where it has a marked anti-inflammatory and analgesic effect due to its direct action on the nerve. there then follows a rapid alleviation of the symptoms and the swift return to active functionality. Knee osteoarthritis is due to a chronic degenerative inflammation of the cartilage, the synovia, and the joint capsule. It causes rigidity, pain, swelling, and, as a result, difficulty in walking. HILT reaches the cartilage and has a powerful anti-inflammatory effect, relieving the tendons and muscles from the fatigue caused by the incorrect posture the pain has imposed. Thanks to this effect, there then follows a progressive and fast improvement in the clinical situation. Ankle osteoarthritis is caused by a chronic and degenerative inflammation of the joint cartilage between the tibia and the astragalus, and can also involve the synovial membrane and the joint capsule. Chronic or intermittent pain, swelling and rigidity are a result. HILT penetrates to the deep-seated joint, noticeably reduces the inflammation, stimulates lymphatic drainage, and enables the reabsorption of the swelling, thus contributing with its analgesic effect to pain reduction and a rapid return of functionality. A hematoma is the localized rupture of tisular and vasal elements following a trauma. The associated pain depends upon the compression that the blood exerts on the tissue and the inflammatory response. This leads to pain, swelling, and a reduction in mobility. The HILT impulse reaches the deep-seated tissue affected by the blood loss, stimulates the circulation and the lymph-draining pump, rebalancing tissue metabolism for rapid return to functionality.